Well, good morning, everyone. I am in Cleveland at the lottery headquarters today as we talk to our two winners from last night, the fifth and final winners of the scholarship and fifth and final winner of the Vax-a-Million $1 million. And very, very excited. I also want to mention I just had the opportunity to meet Sharon Bicknell and Sherry McLean. They are the face and voices of the lottery, and they're the ones who have been announcing who the winners are. So good to see you guys. Thank you very much for your great work during this. Vax-a-Million has been a great success. Just kind of looked at some numbers. Just the first week we went from the previous week before the announcement, we had, I think, 92,365 people got the first shot. The immediate week after the announcement, we were at 187,238. The next week, it was 142,713. So been a big success, and now we're going to have the opportunity to talk to our two winners from last night. Ms. Diaz, how are you this morning?
I'm doing pretty good, thank you, Governor. Thank you very much. How about you?
So let's go back to last night. Fran and I were actually in Akron. Michael Murray knocked on your door.
Yes.
And had a phone in his hand.
Yes.
And tell us what happened.
Recording in progress.
Excuse me for a second. Okay, he told me someone wants to talk to you. So as soon as he showed me the camera, his phone, I recognized your face, and I said, I said to myself, oh my God, I think I'm the winner. And sure enough, and you said it, and you congratulated me, and of course, I was super excited. I'm excited. Couldn't sleep last night.
So you told when Fran and I were talking to you last night, you told us, I think, that you had been talking about this at work that day.
Yeah,
I think.
Yes. I work as a dental assistant, and one of the patients mentioned, today is the last contest for the vaccine, and I was thinking to myself, oh my goodness. God, let it be me. And here I am. Does he listen to me?
Well, that's great. So how well did you sleep last night?
I did not sleep at all. Well, maybe an hour or so. I couldn't sleep. I was too excited and just thinking.
So your fellow workers, did they, some of you contact you after that?
Yeah, a lot of people were, my coworkers and my friends, they were calling me, they were texting me, congratulating me, very excited for me, very excited, yes.
So have you thought about how you spend the money yet, or you just still thinking?
Pay bills help my family, and I'm still trying to get grasp of this, and I just don't know. I'm sure I will have plenty of to spend it.
So when you got your vaccination, did you have any hesitancy about getting vaccinated, or you got your vaccination pretty early, I think?
Yeah, I got it early. I was hesitating a little bit because sometimes I have some food allergies, and then I decided that the risk of getting COVID was bigger than maybe the risk of the vaccine. So I figured, I think it's better to get it.
Well, that's good. Well,
yes.
Well, thank you very much. We'll be back in touch with you and talk within a minute, and then some of the members of the news media may have some questions for you.
Okay, and thank you so much to you and for having this great idea. Thank you.
Thank you.
Thank you very much.
Well, let's go to our scholarship winner, Sydney Dahm of Brecksville in Cuyahoga County. She is here with her mom, Jennifer, and her dad, Jeremy, and hope you guys are doing well. Looks like you're at school, I believe, right?
Yes, that's correct. We are actually at the school.
So Sydney told me that she did not want to miss the camp that was going on there. So that's exciting. So you won't have to miss very much of it today anyway. Tell us, Sydney, what do you do at the camp? What kind of things are you doing?
We create mosaics.
You enjoy that?
Yeah.
So, Jennifer, you told me last night when Fran and I came over, you told us a little bit about the decision you guys made as a family for Sydney to get vaccinated and the timing of that. You want to tell us a little bit about that?
Sure. We were always planning to get her vaccinated, but we were going to wait later in the summer to have her fully vaccinated by the time school started. But when you announced the Vax-a-Million lottery, we thought, hey, this is a good time to maybe do it now. And we did, and we can't believe it paid off.
Well, we kind of looked at the dates. I think we announced it on May 12th. You signed up on the May 18th and then got vaccinated on the 22nd for the first one. So, one of the things that we certainly wanted to do is not only get people to be vaccinated who might not have, but also, like in your case, maybe to move that up a little bit. And so it looks like that worked. So were you guys? I called Jennifer. I called you first, and what did you think when you got the call?
Yeah, I couldn't believe it. It was a shock. I had kind of forgotten about it. I'd been hopeful the first few weeks that we were going to win, and I'd kind of forgotten about it. And then you called, and total excitement.
So then you called your husband, I think, who was home.
Yes, and he didn't believe me, I don't believe, until he spoke with you himself.
Yeah, I wasn't until we did the FaceTime and I saw your face on the phone. Like, wow, it's really real.
You knew it was not a scam then, huh? Or
Yeah.
not a joke. So, well, great. If Sydney's got a long ways to go until college, so I'm sure you guys have not really. I imagine you've not really talked about colleges very much, but any thought about college from any of you yet?
Well, I guess we know it'll probably be in Ohio. But yeah, she's always been planning on going to college, so it's really fantastic that she gets a scholarship money, to say the least, and we feel very fortunate. It's like now we got one more or less taken care of for college, and got one more to go.
Well, Sydney, you told me that you love to swim. You're in synchronized swimming. That's how long have you been involved in that?
I think about 3 years.
You enjoy that?
Yeah.
That's great. And you actually have a school team in synchronized swimming. Is that right?
Not at the school. It's at the rec center.
At the rec center. Okay. Well, very good. Well, some members of the news media may have some questions for you, so we'll be back with you in just a few minutes.
Right.
Congratulations. Thank you. We'll talk for a moment about vaccinations for 12 to 17-year-olds. We're focusing this summer. We're doing some things which I want to share with everyone. First of all, outreach to schools. Some of our schools have had multiple opportunities to partner with providers and offer vaccination clinics on site for students. I appreciate those school districts that have already held these clinics, making it more available, make it easier for families to get their children vaccinated. A survey that we did of schools across the state showed about 200 school districts either have or plan to offer vaccination opportunities on site this summer. The second thing we're doing is outreach to different community organizations. We partnered, for example, with the boys clubs, girls clubs, to offer vaccinations at those clubs. Also, we have 67 local providers, those who provide the vaccine. We'll be hosting vaccination clinics in partnership with some summer food service programs. So some of the summer programs, there'll be the opportunity for young people to get vaccinated there. Number three, we're doing outreach again through local providers. When we say providers, we're talking about people who are actually providing that shot at the retail level. We are working with pediatricians' offices. We're also working with other family doctors to become providers so that students can get the COVID-19 in a place that the family trusts and the family is used to going to, and that is the pediatrician's office or the primary care physician's office. And I would just say, if any pediatrician out there is watching this and you do not have the vaccine and you want the vaccine, we want to provide that to you. So be in touch with your local health department. You can be in touch with the state health department, and we'll make sure that you get that vaccine. It's important. We're reaching out to more and more primary care physicians, pediatricians, so that they will have that vaccine on site so that they'll be able to administer that when they have a patient in there who wants to take it. And fourth, we're targeting and doing focused outreach to underserved areas, as we have been around the state. To increase access for students in underserved areas, we will continue to assist in expanding school-based healthcare services and increase the number of community-based health workers in high-need areas. We will also offer vaccinations at all job and family service locations that serve directly customers. So all jobs and family services areas that serve customers, we are offering it there. So those are some of the things that we do. DoorDash, let's talk about them for a moment to encourage vaccinations. DoorDash has partnered with some Kroger and Giant Eagle locations for a special promotion beginning tomorrow and running until June 30th. Anyone getting a vaccination at select locations during this time will receive a $25 DoorDash gift card. So we appreciate all the incentives that are taking place. We don't have time to go through all of them, but there are a lot of incentives out there, and we appreciate that very much. On another subject, license renewal deadline. Soon after the onset of COVID-19, Ohio extended the renewal deadline for those with a driver's license or identification card or vehicle registration that expired between March 9th, 2020 and April 1st, 2021. I want to remind everyone that those extensions are set to end 1 week from today on Thursday, July 1st. So it's time to get back. If you have delayed doing that, now's the time to go do it again. According to the BMV, there are around 100,000 driver's licenses and 221,000 vehicle registrations that expired during the time period, and these individuals have, as of this date, have yet to renew. So we just urge them to renew. We also urge them not to wait until July 1st because there'll be a big rush at the end, and so take the opportunity to do that now. You can take care of your vehicle registration online at bmv.ohio.gov. That's bmv.ohio.gov. If you need to go to your local Bureau of Motor Vehicle office in person to renew your driver's license or ID, you can save time by checking in online with the BMV's Get in Line online system. That's called the Get in Line online system. The system holds your spot in line until you arrive so that you don't have to wait there in person. Again, that website is bmv.ohio.gov. As I mentioned yesterday at a press conference in Columbus, our numbers are good. Our cases are going down. Our hospitalizations are going down. But the virus is still here. And with the variants, it can become even more dangerous for those who are not vaccinated. We are still losing people in Ohio. So I asked our team how many people currently are dying in Ohio of COVID per week, and that number is about 100. So a lot better than it was, but every life is precious. We mourn every death, and 100 is still 100. That's 100 of our fellow citizens who are still dying every week from COVID. So very, very much still there. The deaths are shifting to a younger age group. And we could expect that because the higher age group, if you go over 65, for example, we're over 80% of that population that's been vaccinated. The numbers are lower as we get into the lower age groups. So that there's been a shift. If we looked at where we were 6 months ago, 4 months ago, 3 months ago, even dramatic numbers heavy on the higher age group. Again, about 100 deaths a week. 100 Ohioans are dying per week. The deaths are shifting to a younger age group. During the winter surge, more than half of the people who were dying were 80 or older. Today, those 40 to 79, just as to take one age group, those 40 to 79 make up more than 65% of our deaths. So 40 to 79. And we are seeing deaths, of course, among 40-year-olds, 50-year-olds, et cetera. Yesterday's CDC Advisory Committee on Immunization Practices started meeting to discuss several topics, and including heart issues, heart problems in younger people related to the vaccines. Dr. Vanderhoff is hosting a media conference shortly after this one. I think it starts at 11:30. And we would invite news media, anyone to get on there. Dr. Vanderhoff will have two cardiologists who have studied this issue to discuss their findings. These are Ohio cardiologists, and they will be on and ready to discuss the issue and ready to answer any questions that anyone in the news media might have. A very important topic. Let me again, I mentioned this yesterday, step up to quality in childcare. Ohio has made significant progress over the last few years. We're improving the quality of childcare in the state of Ohio. We need to continue to do that. So there's language that the legislature is considering as they look at that. In the conference committee, I would just urge the state legislature to continue us down the path to high quality childcare. It's very, very important. We're now ready for questions, and let me just open it up.
Governor, first question today is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor, and I couldn't help but take note of Esperanza congratulating you for a great idea, and Jeremy and Jennifer saying they were going to wait till later in the summer, and then you announced, and so that was right up your alley of what you intended here. And so I wonder what is next to try to gin up more awareness and acceptance. And you're at lottery headquarters, you've got the structure in place. Has there been talk or any consideration of a second round of Vax-a-Million?
Well, John, we certainly have talked about doing something in addition, maybe doing something a little differently. We've talked to some people in the private sector to see what they might be willing to do. We don't have anything to announce yet today, but I think that, we may come forward with something, and stay tuned. The other thing I would say, though, is I think it's important for us to continue to look at the facts. And so, for example, we're doing this 11:30 press conference today. I will not be on it. The experts will be on it, and they'll talk about the whole issue of the vaccine in regard to the microcardial potential problems that might exist there. They also are going to get into, though, what problems exist in that same area when people are not vaccinated and young people end up getting the virus. So, all of this is a weighing of risk and a comparison of the risk. And I think news conferences like these three doctors are going to do today are very important. I think people want to know the facts. I think we have the obligation to get as many of those facts out as we can. And I would just say to anyone who is thinking about, should I have my child vaccinated? Maybe I have a 15-year-old or 15-year-old grandchild. Should that child become vaccinated? I would say talk to your doctor. Talk to your pediatrician. Talk to your primary care physician. Talk to someone in the medical field who you really, really trust. I think that's probably the best advice that we could give.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Well, first of all, congratulations to the winners. That's really awesome. I'm very happy for you. And Governor, my question for you is, we are starting to see in different places in the United States where there are pockets of infection. And these are largely in unvaccinated areas, and they're overloading hospitals. And the kind of things that you were worried about at the very beginning of this pandemic, quite frankly, because this new Delta variant is so infectious and it spreads so easily. Are we seeing any of those pockets yet in Ohio? And if we do see any of those pockets in Ohio, what are you going to do about it? Are you going to try to put some limits back in place for only those areas or for the whole state? How do you handle that?
Well, Joe, thank you for the question. I am concerned very much about that. As you know, we publish the percent in each county of people who are vaccinated. And it ranges a long, big range. And so we have counties in Ohio that are very under-vaccinated. So yes, I am concerned about those counties in the state of Ohio that have a very low vaccination rate. What we're seeing in other states and what we read from the experts is that those areas, those pockets, are very vulnerable. You put on top of that the fact that they're under-vaccinated, plus, as you pointed out, this Delta variant is more potent. We don't know if it's more potent. What we do know, though, is it's much more contagious. And so there's a grave concern about that. So the solution is pretty simple. We have the solution. It's here. It's called the vaccine. So we continue to urge people, particularly people in underserved areas. That is the most dangerous area. We continue to lose people. We're losing 100 people a week. Not what it was, but think about this. If we did not have the experience of having lost many, many more people than that per week, we wouldn't feel so good about losing 100 people a week. That's a lot of people from a problem that we didn't have 3 years ago. So we know that the vaccine is powerful, and we know that it's very powerful even against when people get 2 doses. It's very powerful still against the Delta variant. So I just would encourage everyone to really think long and hard about this. As far as what we do, we'll cross that bridge when we come to it. But prevention is always better, and the vaccine is powerful. It's here. We need to use it.
Next question is from Laura Hancock at cleveland.com.
Congratulations, both to Esperanza and Sydney. Esperanza, my phone went out when you were describing your job. So if you could explain what your job is again, what you do. And then Sydney, my question for you is where do you go to school? What grade are you going to be in this fall? And then for both of you, have either of you contracted COVID? Do you know anybody who's had COVID? Anything like that? Thanks.
Sydney, let's go to you first. Let's go to you and your family first, and maybe tell them where you go to school.
I go to school at Brecksville Broadview Heights Middle School.
And how about anybody in your family had the virus, or anybody that you guys know? Any friends, family members?
Yes, I've had it. I had it after Christmas.
And how'd you do?
It was really mild. I was fortunate. So.
Yeah, and someone on our son's baseball team had contracted the child virus that's associated with potentially getting COVID, and I know that actually put him in the hospital for quite a period of time. I know his family was very, very concerned. As were all of us. We're very excited he recovered well. So yeah, and we know that there's a lot of real dangers associated with the virus, even for kids.
Yeah, you said that was someone on your son's team, did you say?
Yeah. Mm-hmm.
Oh, wow. How old's your son?
11.
11. Wow. Esperanza, what one of you can answer the questions.
Okay, I do work as a dental assistant. Like she was asking about my job. That's what I do. I am a dental assistant. And regarding if I know someone that had the COVID, I did. One of my friends and her whole family got the virus. They were really sick, but like a very strong flu, but they recovered very well. I'm happy for them. Yeah, I was worried about my friend when it started. I was really concerned, but they are okay.
Good. Thank you.
Thank you.
Next question is from Alexis Moberger at WSYX in Columbus.
Good morning, Governor. This is a question for you about the state budget. The deadline for the budget is coming up. Inside the budget, there's about 28 policy issues. Do you see the budget getting done in time? Really just seeing some of these issues are now sparking debate. Do you believe any of those issues will stall the budget from getting done?
Well, I'm an eternal optimist, as you know. I think the budget will get done on time, and I think Senate and the House are making some real progress. This has, I think, from what I could observe, has been a good budget process. There may be some issues in there that present some problems, but I think they can work that out. So I'm optimistic. As I've kind of joked with members of the General Assembly, I spent 20 years in the United States Congress, and I'm used to Congress not getting a budget done. Many years that was the norm, and seeing, continuing resolutions go on for months and months. And so it's good to see the legislature moving so well, and I think we'll have a good budget.
Next question is from Grace Deng at the Columbus Dispatch.
Hi, I just wanted to congratulate both of the winners, and I also have a question for the winners. I was wondering what your personal experiences with the vaccine were, and whether you would recommend your friends and family get the vaccine, even though the Vax-a-Million contest is over.
Esperanza, you want to start?
Yes, I got the Pfizer vaccine, and I did not have any side effects. I was completely okay, and I would recommend it to everyone. I think it can save lives, a lot of lives.
Sydney, we'll go to you guys, you and your family.
Yeah, I know in my case. Yeah, I mean, I just a little sore arm the first shot, and I hardly even noticed the second shot, which I think most people usually feel the second shot more than that.
It's easy on you, right, Sydney?
Mm-hmm.
You had no problem with it.
Mm-hmm. Okay. Yeah, we definitely encourage more people to go get the shot, especially since our son is not eligible to get the shot yet because he's too young. So the more people get vaccinated, the safer he will be then.
Great. Thank you.
Next question is from Justin Dennis at MahoneyMatters.com.
Good morning, Governor, and everyone. Congratulations to all the winners. Governor, was wondering where you think we're going to go from here. We've been meeting like this regularly for about a year. Wanted to see how much more often you think you're going to be updating us on the coronavirus, what you expect to be talking about, how much more you think we'll be meeting like this regularly?
Well, we started off with press conferences every day, and then we kind of pulled back and had a couple every week. And we've been doing the press conference now around the Vax-a-Million. I think in the future, I'm still going to be certainly available. It will be centered as we move away from the virus. It'll be more centered on what we're doing here in Ohio. The next few weeks, probably a lot of discussion about the budget. There's a lot of things that our administration wants to do that are not COVID related at all, and we'll be talking a lot about those. So, I think we're evolving. We're moving moving forward. But I certainly will continue to be available to media. A lot of this will be more surrounding events or announcements of specific things. But I'll be available, and people will have the opportunity. You'll have the opportunity to ask questions. So.
Next question is from Dan DeRose at WOIO in Cleveland.
Hey, Dan.
Good morning, sir. Congratulations to our winners. Yet another Northeast Ohio winner. We're pretty proud of that. So congrats to the Dom family. Governor, sometimes it takes a sledgehammer. And at this point, do we need to be hearing from ICU doctors and nurses and staff who have people that are sick now who probably wished that they had taken the vaccine? Do we need to get more, I don't know if we want to say graphic is the word, but do we need to hit people with a hammer saying, look, these people that are in the hospital right now chose not to take the vaccine, and look at where they're at? Do we need a stronger message?
Yes, I think so. I think you're spot on. We should not shy away from the truth. We should not shy away from the facts. And we are at this kind of strange time. We judge things in life kind of relativity. What's relative? We compare it to, what was before. 100 people dying a week is a lot. But yet we're not really impacted by that because we were losing hundreds and hundreds of people before. So it sounds better, and it is better. But we really have a tale of two groups today. Those people who are vaccinated and those people who are not vaccinated. And their risks are just fundamentally different. And the sad thing is that if there are enough unvaccinated people, then the virus circulates much, much faster. We have seen in our nursing homes, while we have made great progress in our nursing homes, the number of cases is down dramatically. Deaths are down dramatically. And yet we know that we've seen several, at least, cases where people who are vaccinated, residents who are vaccinating in nursing homes, came down with the COVID again. And we can only surmise that this was coming in from staff that were not vaccinated, because we're running roughly 50% of staff that's not vaccinated in our nursing homes. And because of that closeness of how people live together, work together, that puts at risk the people who have even been vaccinated. And 90% of the people who live in nursing homes have been chosen to be vaccinated. But unvaccinated people in that environment, inside, bringing it in, pose an additional threat to those individuals. So, people choosing not to be vaccinated, they have every right to choose not to be vaccinated, but it does not only put themselves at significant risk, but it puts other people at risk, even when some of those other people have made the choice to get vaccinated. So I don't think we should shy away from the facts. I don't think we should shy away from the truth. We all want this to be over with. If you go out here in the streets of Cleveland right now, people are excited. They're happy to be seeing other people. They're happy to be back in their offices. They're happy to be able to go out to a ball game, do all kinds of things, watch the Indians play. So that's great. But we just have to also realize that if you're not vaccinated, you're in a much, 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 much higher risk population. And as you say, hearing from people, doctors who are dealing with people who have the virus is part of that reality.
Next question is from Gabriela Garcia at WBNS in Columbus.
Good morning, Governor. Winners, congratulations. Kind of twofold here. I know my colleague asked yesterday about future incentives. I was just wondering if you could at least give us a hint as to what future incentives might look like statewide, and when might vaccination efforts like statewide, sending trucks to churches, libraries, etc. When will that stop, and when will the vaccine only be available at local doctors' offices?
Well, I think that we, it's good to make it available in as many places as possible. So one thing you're seeing is the closing down of mass vaccination sites. You saw it Fran and I were at the Celeste Center yesterday morning as they're winding down. So the big mass vaccination sites are closing across the country. But we have taken the attitude throughout this that we want it a lot of different places. From the word go from the beginning, we had it out at a lot of different places. We are now really encouraging primary care physicians, doctors to have it available when your patient comes in. But we also want to continue to have it available through the health department. We also want to have it available through pharmacies, through our federally qualified health clinics. We don't want to pull this back. We want to continue. So throughout the summer into the fall, it will continue to be available in a lot of different places. What was the other question? I took the second question first.
Any clue or hint as to what's the next statewide incentive might be? Just a little hint.
Yeah. Well, something I said yesterday might be a hint. Yesterday I was asked the question, and I was asked if I had any regrets about the Vax-a-Million, and I really don't. But one of the things that some people have pointed out, and a lot of Ohioans have pointed out, is they might be also incentivized by smaller prizes, but more. And so that was something that certainly has been pointed out to us as a possibility, as a way to potentially motivate people as well. So we'll see.
Governor, next question is the last question for today, and it belongs to Jim Oddie of WHIO in Dayton.
Governor, specifically, how do you reach those people, especially 18 to 35, who have been thinking about this for months now and have the ability, probably at the end of the block, to go down and get their vaccination? They've seen your messages on social media, your briefings on the news, yet they continue to resist. Their reluctance continues. How do you break through and convince that one group that remains to pick it up?
Well, Jim, that's the question I ask myself every day, is what else needs to be done to get information to people who have not been vaccinated yet. We know that there are people who are never going to get vaccinated. But we also know that if you look at a younger age group, that it is an under-vaccinated group, much less than older Ohioans. So the higher you get in age, the more vaccination rate goes up. We know that if we're going to not have a huge surge in the winter, not have spots in Ohio where there's outbreaks because a lot of people are not vaccinated and because we have this new Delta variant. We know if we're going to get through that, we've got to step up and have more people vaccinated. And the age group where we can make the most movement is those who are 12 to 35 or 12 to 40. That's the most under-vaccinated group. So we know that this is the group that we have to look at, we have to talk to. And again, I think it does come back to individual doctors talking to their individual patients and comparing the risk and doing a risk analysis. That's what our doctor, Dr. Kevin Sherritt, said to Fran, said to me. I asked him, what do you tell people? And he says, I just kind of walk through the risk. You get it, you don't get it. Here's your risk here, here's your risk here. And then he says, there's no comparison. Huge, much more risk for those who are unvaccinated. Very, very small risk for someone who gets vaccinated. So I think, trying to get the facts out. Having the doctors, for example, at 11:30 today, who are going to talk about the risk when you get, for a young person who gets the virus, what long-term impacts could there be? What myocardial risk is there in regard to getting the virus? I think the facts are the most important thing that we could do. I mean, we can talk about incentives, but those could be helpful. Well, Vax-a-Million was certainly helpful. But probably the most important thing is what individual doctors are telling their individual patients. We have to continue, as far as the state is concerned, to make the vaccine as available as we can in as many locations as we can. It needs to continue to be convenient, easy to get, and we continue to drill down, work with the local health departments. Some of them are knocking on doors. Some of them are going to festivals. Some of them are going to ball games. I mean, just make it available so that, when people are ready, they have a place to conveniently get it. That's what we're going to continue to do. So thank you, everybody. Good to be with all of you. And again, I'm reporting today from the lottery in Cleveland, Ohio. It's a beautiful day outside in Cleveland. Thanks, everybody.